If you are born with an ovary, this is going to impact you at some point in time. Moodiness, irritability, people telling you, your friends telling you, hey, you're not yourself.
I feel vulnerable and seen right now.
This isn't just something to get through, but it's an experience. It's part of your journey. And it's only going to get better if you have the right support.
Hello, and welcome to What the Flo. I'm Anique Coffee, and I'm about to turn 40, and from everything I hear, see, and read, it looks like I might be in for some huge changes in my life in the next 10 years. So, I want to know what the flow might happen in my body this decade. My guest today is an absolute expert in women's health post-40. Dr. Jila Senemar is Miami's leading menopause and midlife wellness specialist. She's on a mission to help women feel truly themselves again. And Jila and I are going to delve deep into what I've got coming by exploring the big questions so many of us want answered. How do we know when we're in perimenopause? All right, Dr. Jila, what drives you to be so passionate about perimenopause?
So I think a lot of this comes from personal experience with my patients. I've seen my patients for over, their reproductive years. So for the past 25 years. So a lot of them have kind of grown up with me. And to see them go through these shifts and changes and not know what is happening to them was where I found a missing piece of the puzzle. And that's when I knew, okay, there's more happening. We haven't spoken about this enough. And we need to know what's going on with women. Again, they've been great, no problems. We went through reproduction. And all of a sudden now they don't feel like themselves. They're not happy in their marriages. And they just don't feel like they can control what else is going on. And we as women tend to burden ourselves with everything, right? We want to do everything. We're the mom, the partner, the, professional. We're taking care of our younger kids as well as our older parents, right? So the, sandwich generation we talk about so much. And so women didn't have the tools to kind of get through this on their own. So that's kind of where I went in. I was like, okay, something's missing. What can we do better? And I think that's what started this whole passion project for me, which is, I like calling it a passion project because that's really the impetus on us as healthcare providers, as OBGYNs, as women, to know what's happening and know that it's not just us. It's happened to everybody, and it will. If you are born with an ovary, this is going to impact you at some point in time. And so we need to really delve in, and that's really what kind of pushed me to make that decision. I was standing at a fork in the road. What am I going to do with my career in the next chapter? Delivered babies. I've done robotic surgery, gynecologic care for so long. It's second nature. But there wasn't a lot of passion left. The road opened up for me where it was like, this is where you need to be to guide women to the other side and let them know, hey, this isn't just something to get through, but it's an experience. It's part of your journey. And it's only going to get better if you have the right support.
I can hear a lot of your passion. And I think this is true for so many women too. Like where we go with our passion is such a lived experience for so many of us. So I can see why this path just makes perfect sense with where you are and how your clients are maturing as well. I want to talk more about the signs and symptoms of perimenopause. Is there kind of a definitive set of signs and symptoms?
What's interesting is perimenopause is a newer word now, right? It used to be menopause. And what we knew back, and we're not going too far back. We're talking 4 or 5 years ago. This is all newer. It's been happening. We just weren't talking about it. But menopause was equated to hot flashes and no periods. Then we kind of assumed that's what was happening with perimenopause as well. Like the general population, they're waiting for those two things. They're like, well, I don't think I'm there because I don't have hot flashes and I still get my period. And that's where now we know we're missing the bigger part of the population because perimenopause can last 5 to 10 years. It can start in your late 30s, early 40s, when a lot of women are in the thick of it with young kids, booming careers that they're building and taking care of a household and a husband and a partner and all of that. And so they dismiss their own symptoms. So it's more hidden, and you really need to be in tune to your body to pick it up. And in perimenopause, it's not really the hot flashes or the cycle changes. It's more cognitive. So it's your sleep changes. It's moodiness. increased irritability. Things are bothering you more now than they did before. And the last part of the cognition is the brain fog, the memory, where you're like, I know this person, I can't come up with their name, or it's at the tip of my tongue, I just can't. And I've had some patients that I think I'm getting dementia. I know it. I'm 41 years old and I have dementia setting in. So it's really more the mood and the sleep and the cognition side of it that will start in perimenopause. And then the cycle shifts start happening. And so there are different components to perimenopause, right? There's early perimenopause and there's late perimenopause. And in early, you don't really have a lot of cycle changes. You're still getting your period regularly, just sleep starts being impacted, which then it impacts the rest of your day. You're fatigued. You don't want to do anything. You're unmotivated, maybe a little depression. So that's why a lot of women, when they go to their healthcare provider, whether it's a primary care or their OBGYN, and they talk about these symptoms, if they talk about these symptoms, they're given an antidepressant and sent home, or a sleeping medication, or if they have anxiety, an anti-anxiety medications. Because I see a lot of these women 4 or 5 years down the road with worsening symptoms now, and we're on a slew of medications that really are not getting to the root cause of what's happening, which is hormonal shifts.
Yeah.
So back to your question, what are the symptoms in perimenopause? Cognition, sleep, moodiness, irritability, people telling you, your friends telling you, hey, you're not yourself. Something's wrong. Or you start like kind of distancing yourself from social, gatherings. That's really where we need to tune in and see what's going on.
I feel vulnerable and seen right now. Because I think what is interesting, you mentioned like having the family unit around you. I have an almost 3-year-old being perimenopausal now and noticing all the things that you're noticing, and even the breakdown of relationship and how you parent, and everything is so connected. And it's tough because we are normally in those like early childbearing ages.
Yeah.
And sometimes it's easy to gaslight yourself into like, well, it's just because I have a toddler.
Right.
But actually, when you zoom out and when you have the correct support around you to ask you the holistic questions that you need to be asked to kind of look at these symptoms in a different way, it helps you kind of see what's happening. And then, like you said, tune into your body a little bit more and understand it. Before someone actually reaches menopause, how might their hormones start changing?
So in that time frame of perimenopause that we're discussing, your ovaries are still making hormones. It's just the amount that is being produced on a daily basis fluctuates quite a lot. Like there's a big variation. So 1 month, everything may be perfect. So you have a regular cycle and everything's good. Moods are normal. You're good. The next month, it could completely be a roller coaster where one day you have really high hormone levels, estrogen. The next day it plummets and you just can't get out of bed. And you have no motivation and you don't want to do anything. So it's that roller coaster effect. It's not that you don't have any. It's that it's declining and fluctuating at the same time. And most of us think it's estrogen that starts everything. And it's actually progesterone in perimenopause, hence the sleep and cognition symptoms that we experience. So it's progesterone fluctuations first, then comes an estrogen, and testosterone is usually the last one to dip down.
I've noticed that roller coaster quite a lot and heard from lots of women about the roller coaster. And it's often even described as a roller coaster by people. I think people are really feeling that ride and asking what the flow.
What the flow is happening. Exactly.
What the flow is happening. You're talking about the fluctuations in the roller coaster, but what might be happening to our actual periods and cycle patterns with those hormonal fluctuations?
What I've been told and what patients experience is instead of every 28 days, if they had a 28-day cycle, now it's every 26 days. They're little fluctuations, not enough to signal to them that something's happening. So the more we have these conversations and that women are hearing this from all different sources, the more they can kind of be attuned to it and be like, wait, hold on. I'm not going to gaslight myself. I'm going to write all this down and maybe use an app. You can actually help yourself before hitting the wall of menopause. So at the beginning, they shift from every 28, 30 days to 24, 26 days. Then they become 32 days. Some women, their cycle flow is shorter and others get longer and heavier. That's earlier perimenopause. Once you hit that later perimenopause where there's more dysfunction of the hormones and of the brain ovarian axis, then you start skipping periods. So women will say, I haven't had a period for 3 months, and now all of a sudden it came back. Or I thought I was in menopause, and 6 months later I got a period. Or I'm getting them twice a month. So it's a variation. It's slight at the beginning, and it just intensifies as you get closer to that endpoint of menopause, which is 1 full year, 12 months without a period.
And that is triggered by ovulating more frequently, right?
So
ovulation,
as they shorten, and ovulation could be a part of it, but not every cycle is ovulatory.
Right.
So it could be, you could be ovulating. That's why we also have to be concerned with contraception at this juncture, because there is still a possibility of conceiving if we're not protecting and not looking at everything.
Okay. Let's talk a little more about tracking. So I track my cycle on Flo. I've got mine in perimenopause mode. So I get to track all of the different symptoms and things that are happening in my body, which is super helpful. What are some other things you might be able to see if you're kind of tracking your cycle and your symptoms with something like Flo?
I think the other things that you can see is where in the month the symptoms are impacting you more. Is it right before? Or is it during, or is it right after? Because right before, you're probably going to have more mood symptoms going on. During, you're probably going to have more fatigue, exhaustion. And then after, you may actually regulate, and then you start all over again. So I think it helps because women, once they know what's happening, then they can kind of tune in and be like, okay, this is what it is. I'm going to make some changes to see if it's going to help. And I assure you, if small little changes are implemented, which we'll get into later, it makes an impact. It really does. It's not, we are kind of trained as women, I think, to go until you can't take it anymore, or until something gives, basically. And we don't really want to be doing that. We really want to embrace what's happening. It's a natural part of our biology. It's not a decline. There's nothing wrong. Nothing's falling apart. Reproduction is a part of our biology. Perimenopause and menopause are just part of that continuum. And we can thrive through it and actually come out stronger and better on the other side. So women shouldn't be white knuckling through this and suffer in silence and all of these things that we've been kind of told to do. We need to change that narrative so they understand there's more to come. It's only going to get better. So let's just work together and kind of get you through this.
I like that frame. It's only going to get better, not worse.
No.
Yeah. And I think tracking is so helpful. It's to the connection to self part of it. It's that moment every day, or sometimes twice a day, if I'm noticing different symptoms throughout the day, where I can just kind of tune in, go to the app, put in my symptoms, connect with myself and my body for a second. And it really is the counteraction to the gaslighting that you're talking about, and the disconnection from self that we have just because we're in a busy world. We talked a bit about bleeding. There is lots of anecdotes about heavier, lighter. What's kind of comparison to the early years when we're not in perimenopause? What can you kind of expect? Heavier, lighter? How does that
I think
change?
it depends on the individual and what their cycles look like previously. Listen, you have a woman who's been on birth control pill all her life. Now you're going to start from scratch with her because we don't know where she is and what kind of cycle. And some women, it's 50-50. Some, you take them off the birth control pills and they have much lighter periods. Others will have much heavier periods. We always want to look and make sure there's not an anatomical reason for this. There's not another reason that this is happening. And, blood work, diagnostics, uterine polyps, ovarian cysts, fibroids, any of those things can impact a person's cycle flow. But putting all that aside, let's say it's all done, it's all negative. It's really dependent on the individual and what their periods look like previously. Do they have a history of endometriosis, adenomyosis? Did they have a history of polycystic ovarian syndrome, or the newer terminology of polyendocrine metabolic ovarian syndrome? Any of those things can really impact how they will experience their perimenopause and menopausal journey.
All right, let's keep talking periods.
Yes.
Do women tend to get more kind of skipped periods in their late 30s, early 40s?
So depending on what's going on with their cycles previous to that, some can get more skipping and more irregularity of their cycles. And if there's birth control involved or not, because if they've been on birth control pills and now they stop them for whatever reason, they can start to have more cycle irregularities, skipping them until their body kind of resets. Now, that could also then play into the perimenopause side of things, where the reset is still skipping periods. It could be every other month, or then they go back to regular cycles, or as we get closer to later perimenopause and menopause, the skip will be further in between, right? So it'll be every 2 months, every 3 months that they may miss their period. And then they have 6 months of regular cycles, and then it starts all over again. So it can really vary quite a bit. And I think that's where I talk to my patients and I let them know to get an app like Flo. And hey, download this and input everything that's happening. It gives us more information to work with and to kind of plot out, hey, this is what's going on. And a lot of times I've noticed, they think, oh, I've skipped so many periods. I haven't had a period in 6 months. And then when we actually sit and look at the data, they were off by a few days. So they didn't really skip a full period. So I think the more we know and the more women can see it, the better they can do.
One of the great things about Flo is the doctor report.
Yeah.
So what would be really helpful information for a patient to bring into you from a period tracking app?
Listen, I would want to see all of it, because I want to know their symptoms. I want to know how much we used to do, before Flo. It was like, keep a period log. Basically, they would have a notebook, they would write everything in there. Now it makes it easier, right? And it's a great app. There's a lot of functionality to it. You can even input your symptoms, right? And so it gives them a better overall look at actually what's going on. And then it allows me to spend more time explaining all of these changes. So now they walk away with, they know what's going on. They understand the physiology behind it, and they know what they can do to improve it, and that they're not falling apart, because that's the bigger question. They think something majorly is wrong and off, but to have that peace of mind that, hey, this is part of normal physiology. It might get better. It might get worse. More likely it'll get worse, and that there are things we can do to improve it.
That's why I'm loving this conversation, because it's true. We're told our whole lives, like, you need a regular period. This is like how it's going to be almost forever. And then you do hit that fork in the road that you spoke about earlier of just like, oh no, what's happening now? Mm-hmm. So I love that there are doctors out there like you who are actually spending time to look at reports, to give a holistic view, to have a comprehensive conversation about what's happening. Because as we've spoken about, and I'm sure we'll speak about more, everyone's different. Mm-hmm. So there's got to be different kind of support for everyone that's different.
It's quite an individualized journey, just like your puberty was and your pubarchy, right? Every woman will, if you ask them, when did you get your period? How was it? How was it the first few years? It's completely different. So, you can't really generalize this conversation. This is just more about understanding and knowing that it's normal physiology, because I think we need to destigmatize this so much, because again, it has always been about reproduction, but it is so much of a bigger overall conversation. And we know, and we're going to talk about this, how there is so much more involved with estrogen and the progesterone, the testosterone, and the impact it has on every organ system in your body. So it's not just about reproduction and your periods. We have bigger things going on that we really need to tune into in our 30s and 40s, the decade of opportunity, I like to call it, where you can really optimize yourself. So your 50s, 60s, 70s, and 80s look completely different.
I love that. The decade of opportunity. Mm-hmm. That we hear a lot from women that it becomes almost a superpower to be in perimenopause and menopause.
Yeah, there's also superpowers in perimenopause, because I think one of the biggest ones is this freedom feeling to kind of express yourself however way you want to, where you wouldn't have done it previously. This, I don't really care. I'm in my era of self-care and self-discovery. And if you like it, great, come along. And if you don't, that's okay too. I think personal experience, we were always told, whoever your friends are in your 30s, that's it. You're never really going to make new friends later. So just kind of stay with your friends, right? I beg to differ. It's completely different. It's a different mentality. I'm still friends with all my friends from before, but it's a different relationship. And we grow, we evolve. And I think perimenopause and menopause gives us that oomph, that opportunity to kind of up-level ourselves. And we go to the next level. And it's kind of like, what does that look like? And no one really knows. Like, it's kind of like, I'm going to delve into what feels good for me. And if I can help other people with it, then amazing. That's what we're going to do with this. And so for us physicians, it's kind of like, we're just going to be vulnerable and we're going to talk about it on social media. And I don't really care if somebody doesn't like it. You don't want to follow, you don't have to look at it. But the one person that you help with that education on a daily basis, that's what matters, right? And so it's just a bigger way of giving back because listen, I see patients in my office, but we all want to do more than just the office. So we want to reach out globally, nationally, internationally, and be like, listen, you're not alone. Because here in our bubbles, there's a lot of resources, a lot of people talking about this, but not in other places. What about them? How are they going to get this information? And that's where platforms like this, podcasts, education, things like that come into play where they can get it too. And they can understand, hey, okay, I heard on this podcast, so What the Flow, that this is what's going on. There is something I can do about it. And so I think that is our superpower in perimenopause. And I have noticed it's not just doctors, it's nurse practitioners, medicals, everybody's kind of coming together, health coaches, physician assistants, you name it. Everyone's coming into this women's health space to help women. And I love the explosion of the field. I think it's amazing. I also do want to kind of put it out there where, know where your information is coming from.
Yeah.
Know what the backdrop of that individual is that is giving you that information and take it with a grain of salt. Okay. If everyone's kind of saying the same thing, you're on the right track. But if everyone's saying something and then somebody says completely something different, be wary of that. But again, you're getting the information out there. Women are getting the resources so they know, at least when they go to the doctor, what to say, what to ask. And hopefully by that point, the doctor's on board as well to then help and guide her through.
I think tapping back into the superpower and this last thought, there's a sense of empowerment that's coming up for women now. And a more impetus to advocate for ourselves in a really different way because the experience is being shared a bit more loudly and widely. And that feels like a superpower in so many ways.
100%. Because I think previously it was thought that you went to the doctor told you what to do. It was paternalistic, right? You go, he knows better. And he, because most of the time it was a he. And I'm just going to do what and I don't question it. And now if you start to question, then you're the difficult patient, which in reality, you're not. You're advocating for your own health because you know your body better than that individual that you see twice a year, 15 minutes, if that, right? So I think women are learning to tap into that. They're very respectful about it. And they come in, these are my questions. I've had women come in with pages out of books and I crack up because for me, I'm like, okay, we're on the same page. You came to the right one because I've read that book and I know that questionnaire and I'm ready for you. It makes my treatment of her that much easier and faster versus the individual that we're starting from scratch. And I literally have books in my office. I'm like, can you go read this? Go read this. Then I want you to come back and then we're going to sit and talk about it. And so women taking it upon themselves to really go out there and learn about this. Not that they have to self-treat, but they need to at least kind of have a list of what's going on. What are my top concerns? And these are the things I want to talk about today. So they get the most out of their appointment.
So let's talk about early perimenopause. Does this exist or could this be a signal that there's something else going on? I know for myself as an under 40, I'm definitely experiencing changes that feel hormone related. But what else could it be caused by and kind of what symptoms should we look out for to call it early perimenopause?
So there's a distinction. There's a straw categorization that was created through the Menopause Society, and that breaks down the different categories of peri before you actually hit menopause. And it's very subtle, and other things can kind of mimic the same symptoms. You really need to kind of make sure it's not any of those other things. Thyroid dysfunction can mimic a lot of the perimenopausal symptoms in early perimenopause when the cycles are still not that, irregular. But you could be having fatigue. You could have the brain fog, not sleeping, just exhaustion. And it could be waking, right? It could be a thyroid problem. Or if you have irritability, things like that, again, it could be an iron deficiency problem. So you can't really dump everything on hormonal. More than likely, there is a component of that. But what I have noticed in some women is we do the full lab panel And I'm doing the lab panel really more for the thyroid and the iron. I'm not doing it for perimenopause because, as we know, there is no specific lab test for perimenopause, diagnosis. It's more clinical. What are the woman's symptoms? What's she going through? How old is she? Where is she? And what are the cycles? So that's really more the diagnosis of perimenopause. But when I do the blood work, we're looking for subclinical hypothyroidism or Hashimoto's thyroiditis, which is the thyroid dysfunction, lowered thyroid working due to an autoimmune condition that can be triggered by hormonal changes in perimenopause. So women who've never had a problem, all of a sudden we have this little thing going on. I've had patients in early perimenopause. They have some little symptoms, but nothing that impacts their quality of life, because that is a determinant of whether am I going to treat this individual or not in terms of hormonal manipulation. Is it impacting your quality of life? No, I'm good. I know what is happening. I'm making the appropriate adjustments to my lifestyle to sleep better, have better sleep hygiene, lower my stress levels, right? Make sure I'm eating the right foods, minimizing processed foods in my diet. And I am moving and exercising every day, some form, as well as I have a community around me. Those are the pillars of health. Those are the things that are going to impact how your journey through peri and menopause goes. And so if you're doing all of that and you have slight symptoms, you're good. That can buy you another couple of years until you hit maybe the late perimenopause stage, or there are more hormonal fluctuations where now you don't feel well. Now you're like, now I need help. And that's where we kind of start over again. It's like, okay, let's recheck everything, make sure it's nothing else, and then we address accordingly. So you really need to be proactive with these individuals and make sure that when they come to you, you know what's going on. You sit them down and you explain the reasoning behind it, because they can tell you, I went through it. It's done. I'm fine. I don't really have any symptoms. Why do I need to worry about this? So it's not, hormone therapy was originally looked upon as symptom management. Your hot flashes are bad. Your moods are terrible. Let's put you on this to kind of get you better. But there's a bigger conversation. It's disease preventative.
I know you're real into longevity, and isn't it more about that now these days? Like the hormone replacement earlier in your menopause journey is all about your longevity.
It's your longevity. And longevity is just, we have lots of fancy words. We're talking about this. And it's this space where we are living longer, right? But at what health? What is our capacity? We're living longer. Women on average live 5 extra years more than men, but in poorer quality. And that's all because of this hormonal shift that's happening in midlife around 50 when we go through menopause, and that estrogen drops drastically, that our risk of heart disease mimics men's and surpasses them at 50, 51. Okay. We don't talk about this enough. Women are not aware that their biggest risk of mortality post-menopause is due to cardiovascular disease. And number 2 is osteoporotic fractures. And 3rd is cognition or dementia. 4th is all-cause cancer.
Wow.
Yet that's where our mind goes when you talk about what am I going to get? I'm going to get cancer. No, that's really on the bottom. So in an individual, imagine most women go through menopause at 50, 51, 52. So they've had estrogen all up to that point. Imagine a 35, 39-year-old going through premature ovarian insufficiency. They lose estrogen 11 years prior.
Wow.
So that's really going to impact them. So that individual, really, you need to put them on estrogen, higher doses, until they average age of menopause. So until 51. And then they still get another 10 years on top of that. So it's not 10 years cumulative. It's from where we start. Basically, you get that plus another 10 after menopause. And that goes back to the timing hypothesis that we talk about, which is, why this much and how much? How long can I take this? That's a question we always get. How long can I be on this? And the easy answer is until you don't want it anymore, basically. But the data points to the fact that there is the most amount of benefit is within the first 10 years after menopause. Average age again, 51, 52. So from in your 50s to 60s, you're good to take it as long as no other underlying, medical conditions or anything like that, which most 50-year-olds don't have. Okay. And then, at 60, 61, it's a conversation with your healthcare provider. How are you feeling on it? Any other changes to your medical history? No, I'm great. Okay, then you continue until something changes, or you never really stop. We have women in their 70s now still on their HRT. They're not coming off of it.
Because they feel good.
They feel great. Why would they come off of it? And some who have even tried, okay, let me come off of it and see what happens. They still can get the symptoms. They can get the hot flashes and the night sweats and not sleep and come back and like, okay, I don't know why I did that. I'd like to continue. So it all kind of ties in together. That fracture at 65 started in your 40s because we start losing bone. We start losing muscle at a higher trajectory in perimenopause and more so in menopause. So we're being disease preventative, not reactive and treating a disease once it occurs. We're trying to prevent it from happening altogether.
There's certain conditions, PMOS, until recently PCOS, endometriosis, other conditions that kind of affect when we're likely to experience perimenopause. Can you speak a bit about that?
So PMOS, or polyendocrine metabolic ovarian syndrome, is it's a constellation of symptoms that can start as early as your teens, basically. And we've known this because we have young girls coming in with irregular periods, skipping them, acne, and excess hair growth, weight gain, things that we can't explain. And that's the endocrine metabolic component of it, because there's an insulin resistance component that drives the estrogen dysfunction in the ovary as well. So we used to look at it more ovarian based. So it was kind of in silo. This is all ovarian and that's all it is. So we're just going to treat it as such, where it's a bigger topic of conversation. And it is actually starting in the endocrine and metabolic side of things. And by the time it's bad enough, then the ovarian dysfunction kicks in, and that's where we diagnose. So we were diagnosing it way down the line, right, of where the disease process actually started. So if we can start younger and earlier and manipulate lifestyle modifications, eating the right foods, a few small little supplementation with myoinositol, things like that, use of metformin to, balance out and make the insulin work better in the body, then you actually avoid a lot of these situations and their symptoms improve. So PMOS is getting a big thing right now because we have known there's a metabolic and an endocrine component to PCOS, but we weren't treating it as such. Now, with this one change, of one letter, it allows doctors to look at it as a more broader problem and hence, hopefully, treat it as such and not just put them on birth control pills and say it's going to be okay. Pregnancy is the highest state of hormone shifts, right? Your highest estrogen, progesterone maintains a pregnancy. So a woman who has multiple pregnancies, is it going to change the trajectory of when she goes into menopause? Does pregnancy itself push you into it? Not necessarily. Now, what we have noticed is women are having children later. So what happens is they're pregnant, they have their baby, they go to postpartum, and remember, postpartum is now the lowest state of hormones, and that can kind of mimic perimenopause. And so they go from postpartum into perimenopause. So there is a correlation there. We're seeing that more. And a lot of our postpartum women aren't really being addressed appropriately. They're just being told, you have a new baby. It's part of your change right now. It's normal. It'll be okay. And what we know is actually you really, map out their symptoms. You can tell that they're actually going into perimenopause, into the early phases, and then into menopause after. So yeah, the symptoms can be quite exaggerated.
That makes a lot of sense to me. I've thought about that often, how we're having babies much later in life and later in career, and how also infertility is on the rise too. Mm-hmm. And that complication of like our hormones are going through lots of different things because the age we're in, but we're also trying to conceive, and all these different things kind of are mashing up together. And I even got a text right before this from a friend who was like, wait, perimenopause? Surely you're too young for that. And I'm like, well, from what I'm learning, it's not. And it's part of this like postnatal journey that I'm on to finding this out. And it's all kind of connected.
Yeah. So again, I like to look at all of, from the minute you get your period all the way through when you stop having it. It's a continuum. And it's kind of like, where are you on this continuum? And how is your body shifting and changing through it? And, it evolves. It changes along with you, depending on where certain things happen in terms of where you get your first period, how old you are. That really determines the length of the functionality of your ovary. So younger pubercal girls, like 9, 10, they're going to be more on the late 40 side for menopause versus the 12, 13-year-old, which is more average. They will hit that 51, 52, 53. And then we have some who didn't get their period till they were 14 or 15. And that's my 57, 58-year-old who's still having a regular cycle every month. And she just can't understand why it's happening. But again, it's a continuum. And along the way, certain things can change it, make it faster or earlier. But again, it's really more about what's going on with the body. And, everything in your environment can actually impact it as well.
That's interesting. I've not thought about it like a continuum before, but that's super helpful. And again, it kind of makes sense of your experience when like I was a 5th grader when I got my period. And here we are almost 40. And I'm like, feels too early. But what you're saying is like, it's been a part of my story from even before I knew it.
Exactly.
Interesting. So we are talking about this continuum. So it's a great time to talk about the menopause timeline in Flo. How do you get a science-backed estimate of where you might be on your menopause journey?
Menopause is easier to pinpoint, right? We already know you haven't had a period for a year. You can run the blood work on that, and you can do a full hormonal panel, and it will show everything. So data-wise, menopause, we have it. That's easy and science-backed. But in terms of peri, like we discussed earlier, it's more clinical than anything else. The blood work is good to rule out other causes of the symptoms. But at the end of the day, it comes down to those symptoms that we track and how it's impacting our quality of life and daily functioning.
We know that you're a mom of 3. So how do you help them understand what's happening in this kind of middle of life space?
That's interesting because when all of this started for me, my children are young adults, 20, 21, and 22. So they were already in high school when all of this kind of started, and they would hear me talk. And I used to talk a lot about pregnancy, babies, and now it's switched into perimenopause, menopause, hormonal shifts, and things like that. And so they overheard a lot of it. And so my son, my older one, actually, he has a lot of moms of his friends who are in the perimenopause time window. And he tells them, you need to see my mom. I think you're in perimenopause. I think something's going on. Here's my mom's information. Give her a call. She'll help you. So they understand what's happening, which I think it's amazing. And it really makes me happy and gives us hope for the future. Because this is the younger generation. And I have boys and I have a daughter. And so if the male side of the equation is already understanding this, we're going to be that much further ahead. And my daughter, she already knows what's happening. She understands hormonal shifts and changes. And she has learned how to kind of tune into her body and understand what part of the month it is, what foods agree with her and what do not, and how that impacts how she feels in terms of PMS and things like that. Because, it used to be hamper it down, right? Too much PMS or too many cramps or too heavy of a period. Let's do something about it. But why? If that's a normal part of the process and you have ruled all the bad things out, why do we need to tamper it down? Why not let the body kind of do its thing? And if you make some lifestyle modifications, actually, your symptoms will improve and you may not need medications and things like that. So they've kind of grown up with it. So I'm really excited for the future because I think they're just going to have it so much better.
That makes me so excited for the next generation. Yeah. And especially the way your son is bringing like the empathy side of it as a partner. Well, we've had an amazing conversation and we're going to bring it back in part 2 a bit more.
Will everybody sign on to it? Probably not. Will everybody need it? Probably not, but it needs to be part of the conversation.
When patients come into your office, what are they coming in with the most?
Mood, irritability, rage, where they're just upset with people and they don't understand why.
I call them my murderous days, pre-period.